So how many of you are thinking about system change? Please, hands up. I thought so. That's amazing. So we think about it, we talk about it, we hopefully also do things about it. And today, in this next 40 minutes, I have the privilege to actually talk about what it looks like in practice. How do we move from broad visions to structures that last? So to explore that, we brought together leaders who are not only experts in their own field, but also system enablers. People already reshaping how brain health is understood and, as important, delivered. The panel will come from health systems, innovation, academia, finance, and mental health delivery as well. So please, I would like to introduce the panel. Where are you guys? I'm starting with Mikele, a public health scholar and system innovator with 25. I think I actually want you there. Maybe I should change. Wait a second. Oh, you can sit there. We're all in the same family here. With 25 plus years, over 30 countries, reframed, I would say, women's and brain health. At Roche, she shows the breakthroughs in neuroscience only matters. I think this, for me, is so inspiring when paired with partnerships and equity. It is also about the delivering. So thank you for being here. Allison, there you are. A neuroscientist who proved that all the brains can rewire. She also instrumental, I would say, in Baycrest, where she's a rare ecosystem. She actually built a rare ecosystem where research, care, education, and innovation are all connected. Dena. She began as a molecular animator, making complex science understandable. Today, at BrainMind, she bridges science, capital, and culture to help ideas travel from ideas to actually real thing into society. Dena. She leads Crisis Text Line. I don't know what we do with that, but yeah, I know you do. You actually do. I was going to not talk about that, but scaling millions of mental health conversations globally. I think you have up to 10 million year to date or something like that. With the background in both venture and the non-profit sector, she shows how tech and empathy can scale together when equity is built in. So thank you, all four of you, for being here. System change is, as we know, not about one huge breakthrough or one big idea. It is about what happens when pieces connect. Across organizations, sectors, and even, I think when we prepped for this panel, it was a lot about mind shifts. I think we're going to come back to that. But it's also what makes it tough. It takes patience, persistence, and willingness to work beyond your own field. And that's what we're going to start this conversation with, about the barriers for system change. And I asked the panel to stay really close to the real experience, to even be vulnerable, things that really, maybe fucked up for them. Because I think it is important to be real here. What are the barriers? And the importance of actually name them and talk about them. So let's start with the barriers. And I'm going to hand it over to you, Mikele. At Roche, you're delivering integrated solutions in women's health. What would you say are the most or the biggest system barriers or systemic barriers that you have faced?
Yeah, well, first I just want to thank the organizers for today's event, and to Annika and Pavel when we were preparing for this session. I left our prep call and I told my husband, this is going to be a lot of fun. I absolutely love this topic. I've spent my career focused on performance improvement and change management. It was even the topic of my PhD concentration. So I've studied systems change, I've led systems change, and as you alluded to, I've probably been the barrier to a number of systems change as well. So I thought through kind of a laundry list of a number of barriers that I've seen or experienced, and didn't want to bore you with the laundry list, and instead, pick out one or two with stories. And then I changed my mind. No, I am going to bore you with the laundry list of barriers, because I think the more that you understand and prepare and look for the barriers, the better able you'll be to mitigate them. So hopefully my co-panelists can provide more color, but I'm just going to go through 8 major barriers that I've seen in system change. First one, starting with leadership support. Even if you have leadership support, if that leader changes, leaves the organization or changes jobs, that can derail an initiative. The next one is not including all key stakeholders. So in the hospital system, we were really good at including the key stakeholders within our organization, but not always outside. The patients, patient advocacy organizations, community, manufacturers, we didn't always bring them in for changes that could impact them. The next one is opposition. So you will often find people that don't agree with the change. And if you don't address it, that could lead to sabotage. The fourth barrier is working in silos or isolations. So let's say you do involve the key stakeholders, but you're not regularly communicating or working together or sharing insights. That can be a problem as well. The fifth is lack of alignment in shared vision, goals, or a covert goal. So I experienced a situation where we were told we're going to make this change to infrastructure because it'll better meet customer needs. But really the goal was to have layoffs, and people see through those covert goals. The sixth one is infrastructure. So there can be a tension in infrastructure if you're working in complex organization or in a broad initiative. So for example, doing global work, we may want to roll something out to all affiliates, but certain countries, or if you're in an organization, certain departments may say, well, that doesn't apply to us. We have a unique culture. We do things differently here. So thinking through that dynamic and preparing for it in advance. The seventh, and I think this is a really important one, is that financial, workflow, or personal factors can favor the status quo. So you may have incentives working against your initiative, and understanding and trying to look for those in advance can be helpful. And then the last one I'll mention is scale. So if you're doing a global initiative and you're implementing in a small, lower income country and want to take those findings to Germany or United States, even if they were successful, they may say, well, but that doesn't apply here. We're different. So those.
Thank you. And one follow-up question. If you have to choose, I think that's the thing here. Which one of those super strong, and, I think we can all relate to them, would you say from your experience is the number one barrier for you?
Not having the shared alignment.
Shared alignment,
goals,
yes.
Yeah.
Let's keep that in mind. And I also want to the audience, please think about what about this conversation that we are having that brings most value to you guys, that you take home with you after these 40 minutes. I'm going to ask you in the end. Okay, I'm moving over to you, Allison. Where do you see the biggest barrier in your work, which is very much about the aging lens? I mean, you have a number of lenses, as actually. So please share with us, what are your biggest barrier?
Yeah, I would agree with all of those barriers. I agree also that the lack of alignment is one of the more important ones. A couple I would add is language, that different people mean things by the same words, but they mean different things. So for example, in the Canadian government right now, we have a push to invest, but not to spend. And we need to make sure that the government understands that brain health is an investment, not spending. So we need to make sure that when they're talking in the language of investment, they're actually thinking not just about let's build buildings and let's build bridges, but let's also build brains, because that will build the economy. And I think that we have a little bit of a language issue. Another issue that we face, which is a barrier, is temporal, really. The range over which different groups are working are quite different. So in the academic world, which is where I come from, people kind of like meander along and take their time and write white papers and so on and publish articles. In the investment world, where I also live, things happen very quickly. In the political world, the people in power are thinking not so much about what's going to happen in 20 years, but what's going to happen to get me elected the next time. And so the time frames, I think, don't necessarily add up. It's part of the alignment issue, but I think it's a part of the alignment that we don't normally talk about, the temporal element.
Right. Thank you, Allison. And I think just to be aware of these different, because it doesn't really mean that any of these sort of path or sort of speed should change, but to be aware of them, I think this is the most important thing. As me being an early stage investor, you can probably find out what I am kind of pretty fast. Having a postdoctoral working with us at this moment, we do have our struggles in terms of speed. I can tell you that. So, anyway, Diana, you are in the intersection of science and capital. What systems constraints do you run into when trying to move ideas out of the lab and into society?
So I think we're here in a room full of status quo busters. I think that looking more broadly at the ecosystem of investors, health investors, tech investors, asking them to make the leap into paradigm shifting technologies, new modalities, things that are really well past what people are used to. In brain health, many of the innovations relate to using a device that you might put on your head that literally zaps your brain with magnetic energy or electric energy. These are things that people are not used to this. They haven't experienced this. And so I think there's a tendency to go with what you know. And I think there's also a sense of hesitancy on behalf of investors because they've seen some of the major players in this space try out things like headsets, thinking Apple Vision Pro, thinking about Google Glass, and stumble when they had all the marketing power in the world to try to get that adoption. So driving adoption and driving those early successes and a lack of that for now is a major barrier to the real influx of investment that we need.
Thank you. Dena, you are working at scale with Crisis Text Line. What are the systemic barriers that stop you from driving real systemic change beyond which we can all imagine the everyday challenges that I know you have?
Thank you. And most folks know us for our crisis intervention work, which is not actually why we're sitting on the table here. Really, it's our AI, near real-time AI-powered research and our volunteer model, right? So we're able to leverage the 16 million conversations that we've supported over the last 13 years and the 100,000 volunteers that we've trained to dive in and learn more about actually how the real impact on the brain that we're having is our volunteer model, where 95% say that their own wellness and well-being improves, and 98% say they use those regulation skills, that ability to connect, that empathy, and they use them to help loved ones, coworkers, and strangers in their communities. So system changes for themselves and something that can really spread. And by the way, Josh from California, you're mentioning the power of volunteering, got me very excited today. But the barriers really, and I used to be on the impact investing side of things in my previous life. I think a lot of our time and resources, when we think about user experience, right? Actually, for a minute, how many of you know Danella Meadows if you like system change work? How many system change nerds do we have here? Okay, great, only a few. I get online, search Danilo Meadows, look at those levers for system change. And one of the most powerful is around mindset shift, right? And so how do we shift mindset? How do we shift behavior? Well, our for-profit companies get a lot of investment to do that, to invest in user experience, to invest in, quite frankly, getting folks addicted to a behavior change. And yet, where is the investment on the nonprofit side in the more social sector work to do that? It really doesn't exist. And that's a huge, huge challenge because we spend too much time saying what should people do rather than what will people actually do. And how do we engage and meet them where they are?
Thank you, Dena. I think that's sort of the whole being close to communities, really understand what's working, and working in partnership with organizations that actually have that knowledge. I think you're a good example of that, so thank you. There was a couple of the barriers. We heard earlier from Kana the 5 critical levers that has been identified. And we are now in this setting also going to talk about, we're going to talk about enablers. What are the enablers? And again, remember the panel and the experience of what they're coming in with, because that's a little bit part of what we're going to talk about here. Because it's certainly not just about being aware of the barriers. It's about to be aware of what actually creates alignment and change and spread changes beyond a single organization. So from all of your experience, what has actually shifted the system? If so, just a little. And I want you to reflect on why did it work? Why did it work? Okay, I'm going to start with Allison.
Okay. So I think one of the things I've seen shift the system is this discussion that we're having today, reframing the issue of brain health. For me, also Alzheimer's, aging and brain health, reframing it in different kinds of terms so that, again, it's back to this language. It's about the translation. How do we make sure that all of the different people who need to be involved understand why it is important to them? So we heard before about the importance of telling stories, right? And that is really what we need. We need to have a unifying message, a unifying story. And I think we're headed in that direction. I've seen more people really excited about what's going on because we have been able to reframe it in this way. Similarly, we also are seeing this renaissance that was discussed on a previous
Okay,
panel.
Allison, I'm going
Okay.
to stop you there.
Lots of
Because-
lots of
you're
stuff
not.
happening.
You're certainly not ready yet. I want you to be more specific.
Oh, okay.
Why? What have you seen in your line of work
Yes.
that are actually changing, if so a little, the system? And why did that work for you?
Yeah. So in the area of aging and brain health and the work that we do in terms of both the research but also the investment, I think there's an increased awareness because of some of the language that's out there. And also just because of awareness campaigns. So we have a program called Defy Dementia, which is raising awareness about the fact that at least 45% of the risk factor for dementia globally are things we've got some control over in our lives, lifestyle factors, for example. Getting the word out about that has changed people's approach to thinking about aging and brain health. It's broken down some of the barriers in terms of stigma, which was also mentioned in a previous panel. People were previously afraid to even know what was the status of their brain health because they didn't want to be diagnosed with dementia because they thought there was nothing you could do. Turns out there are things that you can do. And I think that that has been really instrumental. At the same time, we've got that happening while there's this collision of technologies, not just AI, but AI plus AR, VR, XR, plus robotics, et cetera, Internet of Things, all coming together. And so we're seeing this very rapid cycle from research through innovation. And there is more money coming in the space. So we've been fortunate in CABHI, the Center for Aging and Brain Health Innovation, to have funding from the federal and provincial governments, private sector, so that we can be investing in this specific space. And you heard also on the last panel, specificity of investment, I think has been really critical, right? So having groups that are focused not just on any old kind of sector, but for us, we work within the aging and brain health sector from the very beginning of design and development through sort of checking it, does it verification in real world settings, refinement, all the way through spread scale and adoption and equity investing. And we can then make sure that these things are going faster because we know exactly who the right players are. We know
You can sort of matching
exactly
the capital that goes in those different stages.
So it's more than just giving money. You're also doing sort of a bespoke services, whatever they need. It's like precision investing.
Yeah, exactly. I think that's a new term, precision investing. I think that's excellent. Thank you so much. And Mikele, how does this resonate with you? And what have you seen at Roche?
Again, I have another long laundry list, but I tried to think through what's my approach if I'm doing a change initiative for 100 people versus for 1 million people. What are some of those commonalities? And the commonalities, I would say, is that leadership support, but not just support, commitment. So walking the talk, clearly communicating the why and the value for the organization, and even at the individual level, if you can get there, the what's in it for them. Creating those shared goals from the start and metrics of success. You can have different tactics, but the shared goals is really important. And then making sure that those measures are as well, because you need to collect baseline data. And I've been surprised over the past 5 years at how many people I've talked to that have implemented a change. And I've said, what are your, are you seeing an impact? And they said, we haven't gotten there yet. But you actually have to plan for that early on. The next I would say is think about collaboration and partnership models. So we were talking earlier this morning about an early detection diagnosis program where you'd want to involve multiple pharma companies in that. And there can be perceived bias or compliance issues. And so looking at including unbiased third party could be helpful there. Also communicating regularly the progress towards meeting those goals and rewarding and recognizing the achievements. And
follow-up question on that. We actually agreed that I can interrupt them, so I'm not being rude in any way. We talked about that. Just to make that clear. So I think what you're sharing are things that, at least when I don't know if it resonates with you, it's sort of, we kind of know this. It is important with collaboration, it's important. But what would you say as an advice based on your experience to actually go from knowing it's important to actually make it crucial sort of and happen and make it happening?
If you create the financial incentives tied to those shared measures. So, in the hospital world and quality, I'm thinking we have certain things that we've said, if you do this, it will provide better patient outcomes. And when we first asked people, report to us how you're doing, we saw that their performance improved a bit. But when you started to tie financial incentives in a pay-for-performance type program, the rates skyrocketed.
So incentives, I think, that could be different types of incentive, but really early on define what those can look like.
Yep.
Yes, thank you. Dena, building on that, what allows you to scale access and equity together? Sort of what we talk about, technology and empathy. Yeah. What are your advice? What are your experience, rather?
Yeah, I'm gonna get to brass tacks example, right? Like 13 years ago, crisis line standard is just the phone. People weren't even thinking that you could support each other via text. We met, so the key is meeting people where they are, meeting a need and a desire, and making it really, really easy. So we put out a text support by text and made a short code, 741, and made it for anything. You didn't have to sit there and decide, is my crisis right now my gender identity, my disordered eating, my suicidal intent? It was just come as you are. A crisis to you is a crisis to us. And what that meant was that within weeks, we had every single area code. We had texters from every single area code within the United States, and became pretty ubiquitous pretty quickly. And the major players got threatened, right? So, and did not think that we could actually do it this way. But the other thing that I would say then, system change, we leaned in and we partnered. So we showed what was possible. We then got researchers to come and prove that it was high quality. And then we partnered and went to DC and said, yes, 988 should exist. And yes, it should include text. And yes, we're happy to partner and share our lessons, because it's not about crisis text line. It's about making sure that everyone has the support they need when they need it. And now, globally, text and WhatsApp and chat-based systems are becoming standard for crisis intervention.
Thank you. I think just the way you're sort of starting from what's really is needed and not trying to segment it in or making it sort of better for you as an organization, making it slightly more complicated, but actually for the users. And that became very simple. So thank you. Diana, you bring sort of the bridge builder's lens here. What's enabled change will you come up with, or would you share with us, that took root in your networks in the way that you work?
So the way that we measure our mission, which is to bring resources, talents, funding into valley of death innovations that are pro-social, that benefit humanity, we really look at getting people in a room together, inspiring them, putting them together with a shared vision, adding a little social pressure. There are financial incentives and there are social incentives. We convene invite-only gatherings where it's exciting to be in the room. And the way we measure whether this is effective, scientists, entrepreneurs, investors, philanthropists, are, do we have new companies? Do we have, how much, for every dollar we spend on a meeting, how many dollars then get invested into the ideas platform? We do 100x every time and more. And I think we can go far beyond that. We partner with other organizations. We partner with OneMind. We partner with McKinsey Health Institute. We co-host with other groups. We want to share the wealth. There's a bounty here there's a bountiful approach, not a scarcity approach, that I think is really important here. And just one other thing, because I mentioned, somebody from WEF mentioned the need for examples and exemplars to really unlock more funding potential. I completely agree with that, and I'm seeing just now the tides are starting to turn with neurotech investment, because you have major AI innovators coming in to make massive investments. Sam Altman, Reid Hoffman, Elon Musk. Say what we will about anyone's politics, it does provide a little bit of confidence to folks to see that there's a lot more funding heading into this, and that soon we're going to have the success stories to back them up.
Can I say one thing about partnerships?
Of course.
Because it's come up, and I think that that's really the key for where we need to go. And Alfred Njanchi, I don't know if he's here. I know he was here, he was going to be around. He is one of the members of the executive of the International Brain Initiative representing Africa, and he has reported, as many people have heard, a great African proverb, which is, if you want to go fast, go alone. Yes. If you want to go far, go together. Right. And the IBI, the International Brain Initiative, is another great example of that, because it's bringing together brain researchers from across the world. And we've got, I think, Vivian Poupon, who's the chair for the Canadian Advisory Board for the IBI, Jenny Young, who is representing the Canadian Brain Research Strategy, which is Canada's initiative, and I'm the representative for Canada on that. It brings together all of these different groups, and there are so many groups out there. Like, if we can bring them together, make sure that the left hand knows what the right hand is doing, we can go not just fast, but far.
And I think just to reflect upon that, so bringing people together can sometimes be very painful. And I also think that's a barrier that we should just recognize. Taking that time, being that painful, a little bit unknown, hanging out with people that you usually don't. I really think that's such an important enabler for real change to happen. And the four of you are really sort of representing that kind of thinking. So that is a good segue into sort of the last part, the shared priorities. We know that system change is a game of patience. Things takes time. I think we can almost think about it as a road ahead, as more as a map, or in this team we're thinking about it as a we are all sailors, so it's more of a chart. So it's certainly not about everyone walking at the same path, but about aligning on value directions, maybe like a compass, or certainly not a fixed destination. But so I've asked the panel to think about what priorities should we be aligning on now, so the map is clear or clearer moving ahead. And again, I want to ask them to be specific, not just millions of different things. What are the single most urgent priority to align on now in order for the path to become easier to navigate? And who wants to start first?
I can start and build upon Diana's, because
Please.
mine is basically what you were just saying, which is creating and then sharing the clear and compelling examples of return on investment in the brain health space, because then it creates those financial incentives and leadership support. So hopefully we can find a way to share so that we can all use those examples to advocate for this important work moving forward.
Thank you. So if you had that magic wand, what's the first thing you would put in place now?
Some group, assign a group to actually collect those examples and communicate them out to the rest of us.
And I know there's some initiative happening in terms of gathering that, so I think that's, thank you. Who wants to go next?
I can go, we
Yes.
can maybe go down the line. So I think for me, one of the most important things that we need is a set of shared priorities or principles that's going to drive all of us. And it doesn't have to be really, prescriptive. As you said, more of a chart if you're a sailor, or I was able to go to the Upright Citizens Brigade Herald show last night, and anyone who's gone to an improv show knows there's some rules and there's a premise that may be set, but you don't really know what's going to happen. But at least there's everyone going in with a shared understanding of what their goal is. And so then you discover things along the way, but you at least have an end goal in mind. I think that's really what we need. And then from a magic wand, which I assume is going to be the next question you're going to ask me, I really liked the idea that came out from last year, actually, last year's meeting when Shiva was talking about the green bonds, right? One of the problems we have is that in investment, and we've talked about this before, the goal is make money. It's not necessarily do good. I think one of the principles we really want is to do good. And one of the mechanisms may be something like the equivalent of a green bond, but let's call it a brain bond, right? Yeah. And to raise awareness and to have governments committing for investment in these sorts of initiatives in a way that will really focus on the work that needs to be done. Yes, it's going to make some money for people, but the focus is not just on making money, which is back to the addiction issue that was raised, but it's also on doing good and enhancing brain health and brain skills and the brain economy.
Exactly. I hear that quite a lot, that there are not enough of investable ideas to invest in. I think that's something we really have to change the narrative about. All right, Diana?
So, I would take these stories, these inspiring stories, and I would take the shared principles that I think it wouldn't take very long to agree on. I really would, though, infuse into people a sense of their own agency to take action so that it doesn't stay in the land of pontification and maybe next year. What if everybody here in this room, before they came to next year's meeting, had to report exactly what they did to advance all of these priorities we're discussing? It's a bit of a social pressure thing, but I think it's a positive feedback loop.
Thank you.
I'm going to go straight to the magic wand and building upon everything that you're saying here, which is, magic wand, if all of us could shift our own mindsets to some collective abundance. Because right now, especially with less funding going to research, with less funding available in philanthropy, it's a really easy space to get into. It's my regular therapy topic with my therapist, no joke. How do I get my ego in check, and how do I look differently at partnership instead of getting stuck in the mode of just pitching my own thing? So, because we can accomplish more together. And with that, looking for unlikely partners. Let's use this moment, which could be perceived as scarcity, instead to find partnerships that we might not other have. And I know you like specific, right?
Yes, that's one of my things.
So just as an example, we announced on Monday that we have partnered with Aqui Estoy, which means as a nonprofit, we in this particular instance, we acquired them so that we could, they were already operating in 20 Spanish-speaking countries. They couldn't get far enough, couldn't quite implement to get enough volunteers. So we're using this as an opportunity to take what I was saying about user experience, making the volunteer experience really, really easy in the global South, in harder contexts where people aren't going to necessarily have as much economic availability of time, where we have different cultures. But we're going to partner with folks on the ground, and we're collecting partners that we wouldn't have collected before to say, how do we make this really easy? How do we do this in the global South so that it isn't just solutions in the global North? Right. And how do we take these lessons we've learned around volunteering that make our brains stronger because we're helping each other and helping our communities, and quite frankly, people learn skills that they can help loved ones with, even that they might not learn for themselves. How do we spread this? So anybody, partner is my request.
Thank you. And I think it's important. I think I'm thinking of that when you're talking, that what you're talking about is not like soft stuff that goes for non-profit. This is actually important conversation for the for-profit as well. Because we think we need to talk about not just the cost of not doing it, but the potential, the potential of actually making healthy brains. Because I think that's what we are talking about here. And I think it's important to incorporate what you just said, Dena, into that conversation. All right, we are about to wrap up. But I have two things. One is if the four of us, how many are we? Actually 5, but are here next year or the year after, 2027. If you would one systemic shift that would have happened or approach are about to happen, and this is a 30-second per each of you, that you would like to celebrate, what would that be? Allison.
Can I go last?
Okay, you can go last. I'm very flexible. Okay.
Oh, I didn't think about this one beyond the. So I guess the one biggest shift is that we take a book out of Diana's playbook, and we've all done something. We've acted.
Thank you.
I would love a panel that talks about what is different and that involves somebody going from ideation and research to funding to cross-sector unlikely partnership that has resulted in some like actual measurable results. So I look forward to having a collective action panel.
Right. We will sort of hand that over to the organizers, and I think that's going to be an easy one. So Diana.
I'll second that, and I'd like another panel of these exemplar success stories of the people, let's hope within a year's time we have an FDA approval and we have a pathway to commercialization for many more of these incredibly, the potential of these technologies is just incredible, and we're just waiting for that breakthrough moment. So if I could wave the magic wand, that's happened, and they're up here presenting.
Thank you. And Allison, you go last.
I would agree with all of that. I think that those are achievable goals for sure. I would put forward a moonshot goal, which may or may not be achievable, but it's what I really love to see.
Right.
I would love to see at the next UNGA all of the countries coming together and saying, not just here's some brain days, but make it a core element of the UN discussions. I'd like to see that's what's the news. It's people care about the brains. Every country coming together saying, yes, we're going to be working together. We're going to have funds that can flow so that we can make sure that no matter whether an innovator or a researcher or an end user is in, Johannesburg or Toronto, it doesn't matter. We're going to be able to be bringing everyone together. That's a pipe dream for next year, maybe. But that's, I think, if we don't shoot high, we're not going to get there.
But I think there are things happening in that direction as we speak here during UNGA this week. So I want to reach out to you in the audience. What have you taken with you from this conversation that you hopefully will make some sense into the work you do? I think there is a microphone somewhere, and anyone wants to share? Or there was like nothing? And we had,
For me, so I come from the solution side, neuroscientist, and I've developed some technology. So it was really refreshing to see the hunger here from all the panelists to have these success examples. I think success from one year to the next can be difficult. Sometimes you get some wins, but certainly in my case, it's been a decade of R&D before we really have something that I believe in myself as a neuroscientist and is also commercially viable. So very briefly, we're trying to move psychiatry and mental health care, brain health, into the realm of the rest of medicine where objective tools are the basis, are the standard use and practice. And I think we're making good progress in that. Thank you.
Thank you. I think that's it. If there's no one who urgently wants to some... I think there's a one over there, just one more.
Oh, thank you. Thank you very much for this opportunity. I'm a neuroscientist and also a science diplomat. So I really imagine that we get to coalesce the efforts of several stakeholders in order to make the appropriate environment for brain development during the first years of life. This is the future. And this is, for me, the most precious capital that we can invest in the neurons of the kids of the next generation. So this is my wish.
Yes, thank you for sharing that. Thank you. So, collective impact doesn't happen by chance. It requires intentional effort and individual commitment. And I want to thank this amazing panel, Mikele, Allison, Dena, and Dena, because you're showing that commitment. You're showing actually what commitment looks like. So thank you so much.
Thank you.